Hello, once again, it's Dr. Dennis Latuno. Uh, Good morning, good afternoon, and good evening to everyone. Thank you for following me on my channel, Dr. Dennis Latuno. And today we're going to be talking about hepatitis B. So, what is hepatitis B and its clinical presentation? And of course, it's caused by hepatitis B virus. And there's two phases here, the acute and chronic. Acute phase of the infection usually are asymptomatic, and at least 70% of them are in acute phase. And usually it lasts less than 6 months. And then the rest, 30%, will be going into chronic phase, which increases your chances of getting liver cirrhosis, liver failure, and liver cancer. And then the duration of this is 6 months or longer. So usually we have an immune system that fights up any kind of virus in our body, but sometimes our immune system are successful in fighting up the virus, and then of course it just goes away. But the rest, if your immune system is not that strong, and the virus remains in your system. And during acute phase, we do a blood test. Usually the liver enzymes called ALT and AST, they go up to 1,000 to 2,000 range. Usually ALT is higher than AST, and the total bilirubin is normal. What are the symptoms of hepatitis B? Actually, all the acute phases of hepatitis A, B, and C are all the same. They present with fever, loss of appetite, nausea, vomiting, abdominal pain, fatigue, joint pains, and jaundice means yellowing up your skin and eyes. And you have a dark colored urine. Usually we call it coca-colored urine. And sometimes you'll have swelling in your arms and legs. Transmission for hepatitis B, usually mother to child, and occasionally horizontal transmission is very common in Southeast Asia and China, while sexual and percutaneous transmission is common in USA, Canada, and Western Europe. And of course, you can get it with an open wound, sharing of needles, sharing toothbrush, accidental stick from an infected sharp instrument, and also blood transfusion. Prevention is usually through hepatitis B vaccine, strongly recommended for newborns, unvaccinated at birth, people who live with someone with hepatitis B, healthcare workers, IV drug user, chronic liver disease, and those on dialysis. And if you're traveling to a place with high infection of hepatitis B, and men having sex with men. And the three most common vaccine that we use is the Recombivax, Engerix, and Twinrix. And all of these are given intramuscular at 0, 1 month, and 6 months after, so times 3 doses for all of them. Twinrix of note can be given to both hepatitis A and B. Diagnosis, of course, through a blood test. And later on, we do also liver ultrasound, and eventually if you have suspect of chronic hepatitis B or early cirrhosis, you will need the liver biopsy. And the blood tests we usually ordered are hepatitis B surface antigen, hepatitis surface antibody, and hepatitis core antibody. And your doctor can interpret if any one of these tests is positive or not. But of course, if you don't have, if actually all three are negative, it means you're not immune and not protected and has not been infected but still at risk for possible hepatitis B infection, so therefore vaccine is needed right away. And if you're infected, the hepatitis B surface antigen becomes positive. That means the virus is present and can spread to others. Treatment for acute phase usually is supportive. You give IV fluids. If you have nausea, vomiting, gives medication to prevent or treat nausea, vomiting. And then we give immunoglobulin injection within 24 hours after exposure, or you can start hepatitis B vaccine if you have not received it. And the treatment for chronic will need a lifetime treatment. And the most common antiviral medication we use is entecavir, tenofovir, and the two others are levodopa and adefovir. Of note, entecavir has 91 to 94% virological suppression. Tenofovir, if you use it for 36 months or more, had 100% viral suppression, but it doesn't mean that you're cured. You have to keep taking these drugs for the rest of your life. But there's another medication called interferon, and it's used for young people who wish to avoid long-term treatment or women who might want to get pregnant within a few years. And if you already had end-stage liver disease or cirrhosis, then your next treatment will be liver transplant. So you have to be careful, make sure you protect yourself and get tested. And if you test positive, you need to see your primary doctor and most especially gastroenterologist, so that you'll be guided regarding treatment of hepatitis B. All right, it's a short topic, mainly for hepatitis B. And again, subscribe and like and share my channel. And thank you very much for listening. And again, God bless everyone. Bye.